to have a smooth induction of suture. Then you may not find so again clock, one will be at mesenteric end and at one will be at the anti-mesenteric end. So follow this technique in the verbatim in basically, and you will have a good results. For many a good understand the this concept better. And then entering the outside, then entering the other side from the outside and inside. So we end on the other end. So you are inside the lumen on one side, and so this is important. In far, practically you should stop just crossing the corner. Then you should have stopped the other side. So as you will see, there is a little bit of narrowing at the one at this side, and as you reach, so